Lauren, thanks for coming on. Why don't you just like introduce yourself, say where you're at, what level of med school you're at, because obviously you're not a full doctor yet, but you're on the way to be. And yeah, just introduce yourself.
Yeah, awesome. Well, thanks for having me on. But I am Lauren. I am a second year nursing. Nursing. No, that is my prior life. I'm a second year medical student at the University of Notre Dame here in Sydney. And if you can't tell, but I did nursing first and did that all through the COVID pandemic, and then decided I wanted a bit of a change of scenery, and hence jumping over to med.
Yeah, it's a massive transition, right? I don't know if you know like many people who have sort of done that same thing before, but why don't you talk us through like what are the main things that like made you switch from nursing to medicine? Because it's a completely different job as like you're probably starting to find out on like placement and stuff and everything like that.
Yeah, no, very different. I actually had no idea I wanted to do medicine. Even through school, like all of my high school friends would be like, "Nah, she was always going to do nursing." It literally been ingrained in my mind since I was little that I was like, "Yep, I'm going to be a nurse." And it wasn't actually until I was on placement and I looked at everyone else and like how everyone works together, and I was like, maybe I should have looked into this a little bit more because like there's so much, right? There's so much in healthcare. And I kind of looked around and I was like, I think I actually prefer the role of a doctor to the role of a nurse. And that was not something that I expected going into nursing. So yeah, I think it was quite an authentic way to shift over. And definitely not your typical route by any means. I think there was only one other girl in my cohort that was pretty diehard med. And so yeah, it was just a crazy transition. It was literally my second placement in nursing, so my final first year placement. That I actually decided to look around and be like, wow.
Yeah, it's pretty cool. But then you did your nursing degree, which is like 3 years, correct?
Yeah.
And then you were in your first year like working, and then that's when you decided to go down that path and switch across. So then like what did it look like from there? Like did you just start doing like GAMSAT stuff and then all this other like MMI training, and then how long did it take you to get into med from there?
Yeah, well, it was actually my first year of like Bachelor of Nursing study that I decided to make the shift.
Oh,
Yeah, yeah. So beginning of my nursing degree, I'd actually started my nursing degree in the States. And in the States, like it's completely different. Nurses have a similar but slightly different role within the healthcare system over there. So coming back over here was quite different and quite eye-opening. But I sort of decided, okay, in that Christmas holidays of between first and second year of my Bachelor of Nursing, I was like, okay, I'm going to go down the postgrad route. And that was when I was doing GAMSAT, along with still obviously trying to maintain a really high GPA, because that's obviously what you need to get into med. And yeah, I was kind of blind to the whole MMI and interview stuff at the beginning. I didn't want to jump the gun too early just in case I didn't get in. And then that seems like a lot further to fall if you've already sort of mentally interview prepped. But for me, yeah, it was just GAMSAT study all the way. And that was not a time I want to go back to.
I don't think anyone wants to do that GAMSAT stuff again. I mean, I think if I could like, if I could design like the entry scheme to medicine, I would completely abolish GAMSAT. Literally just have it as your marks for uni and then your interview as well. Just like do it 50-50. I don't know what benefit it gains. It just puts people through a whole lot of stuff and then makes you pay a lot of money for it as well.
Literally $515 each sitting.
Yeah, it's not great. And then, so you're in your second year of doing med at the moment.
Yeah, yeah.
And how are you finding it? Like, compared to nursing, how are you finding the people? Like, it's kind of satisfying that you like finally get in and you say, like, oh, I'm gonna be a doctor by the end of it, which is a pretty like surreal thing, right?
Yeah, 100%. I absolutely love it. It was, yeah, really like it was eye-opening when I started. I had kind of, as I said, come from nursing in two different countries. And yes, I could have seen myself doing that, but Coming into medicine, it was the first time I'd say in my life that I've literally done something and been like, this is what I want to do for the rest of my life. Like, it was so exciting learning about all of the different, like, sure, you have that biomed stuff that you're like, this is so boring. I don't care about the Krebs cycle. But everything else, you're kind of like, this is really exciting. Like, this is disease. This is what I want to do. This is what I want to learn about. And so kind of coming into that, yeah, it's been awesome. Like, we have Rural Trauma Week next week where we pair up with some paramedicine students, and we get to do all sorts of stuff like IOs in the field and like really just med stuff, right? Like when you watch Grey's Anatomy, you're like, that could be me. Like, so it's really exciting. I have really, really enjoyed it. And I'm really thankful actually for the pathway that I took to get in, because I think had I come straight from undergrad, or had I come through my life being like, I always want to be a doctor, I don't know if I would have the appreciation for it that I have now. And I think that that's something really special about taking a bit of a more unique pathway into med.
Yeah, it's definitely interesting. Like, I've spoken to a few people who, like, who've done like physiotherapy or paramedicine, or, now nursing beforehand. Like, you get exposed to the health system and then you almost like identify like what role you want to have in it. Whereas, like, what I did, like just going through like, your biomedicine, cookie cutter model, you're not exposed to it until like what, day one, second year, in as a med student, and you're like, I have no idea what to do. Whereas you guys, like, you actually have like an exposure to the healthcare system. So I think that's like definitely something to be beneficial, and yeah, completely different to just like sitting like in a lecture theatre, as you said, like learning about the Krebs cycle. Um, yeah.
Mm-mm.
But you're only going to get more and more exposure, right? So you're in second year. Have you done much like clinical stuff up until this point, or is it mainly like third and fourth year?
Yeah, mainly third and fourth year. Notre Dame, I think, is like, correct me if I'm wrong to anyone watching, but I'm pretty sure it's the last med school in Australia that is still doing the 2 preclinical years, 2 clinical years. And I think that has a lot of pros and cons. But like, obviously, one of the cons there is that you just don't have that clinical experience. We have, like, last year we had 3 GP placements like in the whole year. And this year they cut that back to 1. So it is really, really bare level basic. As I said, like, we have Rural Trauma Week next week, which is probably a lot of people's first experience to actually an interdisciplinary team. And again, I think that suits me in a way, coming from you're not science, but healthcare background, because I don't really need at this point that clinical experience, because I have that, but a different aspect of that. So for me, it was really important to get the basics, to know, the anatomy, the physiology of the body, then what can go wrong. And then next year and the year after, I can go in and be like, okay, I've got some groundwork. Now we can build on that as we go through clinical experience.
Yeah. And how is all the anatomy and stuff, and all the med knowledge? Is it too much? Is it just like, they just try to like cram everything in these like first 2 years? Because yeah, other unis are different. You're right. Like, I think I started clinical stuff in second year, and yeah, it's tricky to balance it because like you like cram everything in first year, and it's like, I know nothing, and you continue to like feel like that up until, I don't know. I still feel like that sometimes. So
Yeah. No, definitely. I think it's very overwhelming. It's a lot of stuff. I still stand by the fact that I think getting in is the hardest. I think once you like, that is like 100% the hardest aspect. For me, at least so far. The rest of it is just, there is so much knowledge that you have to know, but it's not hard, right? Like, it's just the sheer volume is what makes that difficult. Um, yeah, I literally was doing study before I came on here, and our exams are like 2.5 months away. Like, the stress is so real, because there's just so much to know. But I think knowing that you're not going to know everything is kind of what I'm taking. Um, but it is overwhelming, and I think next year when I am in the hospital and I have consultants or regs asking me questions, and I'm like, I feel like an idiot. I think that's when it's gonna get a little bit worse. But at least now I have a little safety in it being preclinical, and no one's breathing down your neck so far.
yeah, I feel like the overwhelming sensation of, oh, I can't know everything, is a little bit unsettling for a lot of people in like med school, who are that type A, like highly strung personality who literally obsess over every bit of information in high school. And then when they're put in that situation where, oh, there's no way you can know everything if you spend like 24/7 studying it, that can really like undo some people. But if you change your mindset, as you said, like I think the best thing to do is like know where to go for certain stuff rather than, know everything. Because like, I don't know, that's gonna be your best friend, right? So especially in internship and like first few years working as a junior doctor, that's going to be like your fail safe, and it's actually going to contribute to your like longevity as a clinician, right? So,
No, absolutely, I have no doubt.
and what in medicine, I don't even know if you've thought about this, or like as you said, like I'm like you thought, oh, I'm going to like be a doctor, I really want this is something I can see myself doing. Did you like envisage like a career, like a specialty and stuff, or do you still like, not sure about what area of medicine you want to go into?
Yeah, it's that's a really interesting question. I actually find that a lot of people sort of message me asking where I think I'm going to go, and I loved emergency nursing. I obviously, like, my background does come down to nursing at the end of the day. I loved working in emergency. I loved working in ICU. And I kind of look at that and I go, is that because that's the area I'm going to end up in? And it very well may be. Like, I love things being quick to the point, come in, like come up with a solution and then let people go on their way. And then the other part of me is kind of like, was it just because it challenged me when I was a nursing student? Like, was it because every single patient I had no idea about the science behind why they were coming in? And so I was researching that. And that was the big difference, I guess, between nursing and med. Med is obviously so heavy with pathophys and learning about the body, whereas nursing didn't really have that, at least in your undergrad. So that was all kind of things that you'd pick up on those clinical placements. So I don't know if that's sort of a false love that I'm like, I love emergency, or whether that was, as I said, because in nursing, like that's what I gravitated towards because that's when I felt like I could learn, broad, like the most expansive things. So I don't know. My family thinks maybe surgery. Um, we'll see, but surgery obviously has its own challenges, and I don't know if I'm ready for a lifetime of, on call and not knowing when your shift ends.
It's difficult, right? Like I've spoken to a lot of people like in surgery, and you look at how their life is, and you know picking like the ideal life of a consultant that you want to have is like the best way to do it, right? So if you registrars everywhere are gonna be tricky, and it's gonna be busy, and it's gonna be like not great. But on the other end of that, what does it look like as a consultant? And that's the interesting thing, and surgery consult, like it depends, right, on the surgery, the surgical specialty, but it could look out pretty good. But maybe surgery, then that's exciting, you know.
Maybe, yeah. Definitely check back in a few years.
And I think we should definitely talk about all like this social media and stuff that you've obviously done for a couple of years now, right? When did it all start, and like what like made you want to do it?
Yeah, I actually can take none of the credit. I was at the gym one day, literally with one of my girlfriends, and I'd said to her, like, this was, as I said, in the heat of the pandemic, like this was 2021. Yeah, it would have been January 2021 when I decided, okay, I'm going to study for the GAMSAT, or just before then, just after Christmas. I'd said, okay, I'm going to study for the GAMSAT, and I was saying to my girlfriend, I was like, I'm struggling to put down TikTok. And she was like, okay, well, why don't you like do a time lapse? And I was like, no, okay, valid. So I'd set up my phone, I'd started this time lapse, and then I watched it back and I sent it to her, and I was like, oh, this is me studying, like I think I was studying section 3 at the time. And she was like, oh, I'm so curious. She's a nurse as well. And she was like, I'm so curious to know like what this is going to look like, because she didn't know anyone. Like, as I said, there's only one girl in our nursing cohort who had even wanted to do med, but otherwise, like, if you're not doing med, if you're not in that sphere, you have no idea what the GAMSAT's about. um she was like, I just want to know what it's about. And so I was like, you know what, I'll post it and I'll just do like close friends, or like the private setting on that. She's like, no, 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 just put it up, just put it up. And I put the first one up and it got about 1,000 views, and at the time I was like, I am famous, like people love this. Anyway, and then it kind of just became a joke. And a couple other girlfriends were like, no, no, you got to keep posting it, you got to keep posting it. And then it just, yeah, began to gain a little bit of traction, quite authentically, and it was a little bit scary. I definitely had people that were not rooting for me, amidst obviously the people that are so supportive, but I feel like you always listen to the negative and not the positive in those sorts of situations. um And look, here we are today, and it's still going.
Yeah, you like it's massive. Like, what is it now? Like something like 100,000+, right?
Yeah, I think it's like 110,000. Yeah.
Yeah, that's insane. And like, yeah, you would have got so much feedback, warranted and also unwarranted. Like, did anything like change like how you viewed like what you were trying to do? Because obviously you started before you got in, right? You were on the road to getting in, which is kind of scary because like you're declaring your route that you're going to go down and you're inviting everyone on a journey. You're not just saying, "Hey, I'm here," which is a much easier place to start from, you know?
Yeah. Yeah. No, I definitely had people that were not in support of me, and I think it did weigh on me for quite a while. I had people being like, "I hope you fail," like, "I would never want X, Y, and Z," or like, "Well, if you've not done this, you're gonna fail section 3," or "You're never gonna be a good doctor if you can't even pass the GAMSAT," like just stuff like that. Where I used to look at it and I would be like, "You know what? Maybe they're right. Like maybe I should not do this." And then the other part of me was like, I'm very competitive. I did like elite sport for quite a few years before nursing and med. And I was like, no, actually, if I wasn't going to do it now, I really am going to do it because I like nothing more than proving someone wrong when they underestimate me. And so I'd actually, maybe a bit toxic, but I'd actually screenshot a lot of the hate messages before I deleted and blocked them. And I put it in my notes app. And I was like, one day I'm going to be able to read this and I'm going to be like, I proved all of them wrong. And they're not going to know because they're blocked, but I'm going to know. And that's all that matters. So I actually, yeah, I think it spurred me on a little bit.
You should make a video about that now. Do you still have the screenshots and stuff?
I do have the screenshots, yeah.
Hey, there's your next video. It's gonna get like a milli plus whatever. That's awesome. I think I remember my sister doing something similar when like she was in high school a few years after me and like had like a photo of like my ATAR or whatever that was printed out and that she used that as motivation. It was funny.
Did she do it?
No.
Oh, no.
Yeah, no, it was but she did very well. So but what was I gonna say? Yeah, maybe surgery is the right pathway then, very like competitive, very like all that stuff. So who knows? Who knows? But that's kind of cool, right? So you did all this stuff and like have you kept up like the frequency of like posting and stuff and have you like, waxed and waned of like do you want to continue? What are people going to look like and think about it in medicine? Because I don't know, it's a different sort of ball game. You're meant to be like this like straight down the line upstanding citizen and not many people like do all that social media stuff in the medical field, right?
Yeah, look, it's definitely been something that's been on my radar. I think like obviously beforehand I was very much posting sort of study content and then I think for me like it's really important one that my sanity and my job come first. Like I definitely if there was anyone that was like no, like you're not going to get a job because of this, like goodbye. TikTok's done, that's it. Like it's not like it's something that I need to live by. I think, look, there is definitely a place for social media within the health sphere, but I think it's definitely picking your niche. I think for me, like, I've had people even in my med cohort who have said that obviously they knew who I was coming in and like that had friends who had been like, oh, what's she like? Like, is she really like that on like in real life? And I think, just kind of reminding people that it is all that I put out on the internet is all that I want to put out on the internet. Um, and so I've kind of definitely dialed that back and been very stringent with making sure that it is study content. And that's it really. Showing what my life is like as far as study goes, as far as med goes, as far as my journey goes. And that's the limit. And I think keeping it professional, keeping it something where if a patient was to see it, they wouldn't feel like they didn't want me to be their doctor because I'd done X, Y, and Z, or because I'd shared views or whatnot. Like I would never want anything that I'd posted online with my personal views, my morals, to affect patient care. And at the end of the day, whatever you put online is going to be there forever. So I think just always having that in the back of my mind, like if my consultant sees this, if the reg sees it, if my patient sees it, how is this going to affect them? Is what I try and keep in mind. And no one's going to get offended by study content. So that's what I'm keeping it with. Yeah.
Fair enough. And like you're not gonna change it as you become like more clinical, or have you thought about like posting junior doctor stuff when you eventually get there?
I think I used to do day in the lives all the time. And then got into Meta. My like postings definitely decreased, mainly because I actually just don't have the time. Um, and then I think like it is really cool what doctors do. I love what doctors do. Even if I'd stayed in nursing and maybe like I'd had this following in a different aspect. I think still talking about like, I got to do this today, that today, this is what it looks like, and advocating for what doctors do, what nurses do, how it works together, what it's like to be a doctor, I think is really awesome. But I think that it's, you've got to be like so careful. And that's something that I definitely have like sitting in the back of my head. So it probably isn't going to be what people want it to be. Like, obviously, you wouldn't film in the hospital, you wouldn't talk about like the specifics of a case, or anything that's at all remotely identifiable. So yeah, it's probably not going to be like those TV shows Emergency where they have explicit consent for everything and I take you along for a day in the life. But I think it would be cool to still share with people, what doctors do, particularly as you go from like junior doctor and you try and get into colleges, and then you go from there and you kind of talk about that whole journey, because I just think it's not very well spoken about.
Yeah, exactly. And I think that's like, you got to tread carefully, as you said, but then also you can't just not speak about it or not want to share information, because that's, what people want. And if it's not like, clear about how this stuff works, I don't know. I just feel like the healthcare industry sometimes is a bit behind in terms of everything. So we're still doing like notes on like paper in some hospitals, or that, to think that like that still happens, it's just like crazy. So unless you speak about stuff, share your journey, all that stuff, you are gonna probably stay like, back in like a few years behind all these other industries and everything. But yeah, as you said, it's very tricky to tread. So it's a balance that is, I don't know what the best way to do it is, but you got to err on the side of caution, I think. Yeah.
100%, 100%, yeah.
And do you reckon like you've got some of your nursing mates to like transition over into the medical field, or are they like gonna become doctors now, or are they still on the nursing pathway, or
Yeah, I have an incredible group of nursing friends. I like when I came into nursing, obviously it was in COVID, so really finding those friends was a needle in a haystack anyway. But they are quite literally thriving. One of them has actually just started her master's in critical care nursing, or like I probably butchered the name of whatever degree she's doing. Apologies, but um, and it's funny, like one of them has since turned away from nursing, realized that it actually wasn't for her partway through her new grad. And I think instead of kind of turning people towards medicine, what my journey has at least shown them and people close to me is that it's okay if it doesn't suit you. Like at the end of the day, we're going to be 30 anyway, so you may as well be 30 and studying something that you're going to want to do for the rest of your life than staying in something because you have HECS debts and you feel like you've wasted your life doing something and you don't want to turn around and just let it go to waste, essentially. And so she's now doing another degree in speech pathology, which is really exciting for her. I think I would almost feel guilty if someone had gone from nursing into med as a result of being friends with me. I feel like I would have maybe given them the wrong idea. Like, I definitely don't think nursing to med is like a superior way to go, or like a different way to go. But I think, and I hope, what I have done is just advocated for finding your niche and finding the area of healthcare that you are going to thrive in and you're going to love. And so kind of supporting everyone on their journeys as well, particularly as people go between different specialties. Like a couple have gone into ED and ICU, and one of them's leaving ICU to go to somewhere a little lower acuity, which is like, it's just really exciting seeing people, yeah, slot into their niche and really figure out where they want to be for the next 20, 30 years.
Yeah, it's scary to think about like that as like your runway, like 20 to 30 years in the same spot. The thing I don't get like sometimes is like you talk to nurses or you see nurses at the ward at the hospital, and some of them like are on the ward for like 30 years. Like they don't like move like the place in the hospital or the hospital themselves. Like that, I just think it was wild when I figured that out. I was like, I don't think I could do that just from like a sustainability point of view. Like I want to like different variety and everything. Obviously, each to their own, and some people want to stay in the same place, doctors, nurses, or other allied health professionals. Like, but that's kind of crazy. Did you ever think like you would be in a ward? I know you said you liked emergency stuff, but yeah.
Yeah, no. Ward nursing is a different kettle of fish, I think. Same as like theaters, right? Like I have a few friends that are in theaters and I look at them and I'm like, respectfully, no. Like I no, it's too cold. I don't know the names of the instruments. Like I no. And like which is ironic given my family thinks I'm going into surgery, but we can cross that bridge at a later date. But I think yeah, for me, like I could have seen myself in emergency for 20 to 30 years potentially. And I think it's hard as well because particularly with nursing, you go through and you become like a CNE or a CNS. And that really is almost like your specialty within whatever ward you're in. Um, Equally, I think it's potentially a lot easier compared to medicine to move around different specialties. And whether that be like floating or different areas, like I feel like as a doctor, really you're only going to be floating as a JMO. So yeah, I think it is interesting when I see nurses in the same area for a long time. I also am like respect. So yeah, it's very interesting. I do wonder where my friends are going to end up and if they're going to stay in the specialties that they've proclaimed as their home. It'll be very interesting.
But you might end up working with them, hey, as well.
Yeah, and that would be pretty awesome. I have like actually in fourth year, I think we go to even in third year maybe we go to Sydney Kids Hospital, and I have a couple friends working there as well. So I'm already like, ladies, you're gonna need to stay because that's gonna be really cool. Yeah.
I think like that's some of the like thing that's happening now because now what I'm 3 years out, and some people, well, most people in like my clinical year at from med school are now starting to specialize, if not already in training programs, and you are making the referrals to them, and you're like working with them, and you're seeing like your whole cohort like go up and fall into whatever category they want in medicine. So I think that's kind of one of the coolest things that is happening and will continue to happen. So it'll be cool for you as well when you start to experience that, not only with like your med cohort, but then also your old like nursing buddies as well, which is kind of cool.
No, I'm very excited for that. We've already spoken about that at length in the group chat.
That's awesome. And hey, just going back to like when you first came into med, obviously you got like your big social following and everything. Did you feel like there was like a bit of like a target on your back, or like people were like wanting to see like, yeah, as you said, like how is she in real life, but also would she like do well, or is she just a nursing student, like that sort of like stereotype? Or
No, no, like my cohort is amazing. I love my cohort. I love at least like the portfolio cohorts from Notre Dame. I know that they've since ended that, which is a shame. But
what is it? What's the portfolio thing?
so for us to get into Notre Dame, we had to do a personal statement, and then we also had to include a portfolio. And in that, you had to prove that essentially you were like a well-rounded person. So you had to show leadership, you had to show like volunteering, you had to show like two other things like community, I think, and service or something. I'm not sure.
Competitiveness as well with the old screenshots.
Exactly, exactly. And so the cohort that I have is so well rounded. Like people have come from quite literally every aspect of life. We have musicians, we have physios like Miles that you had last episode. We have like literally sort of anyone that you needed help with anything that's outside, like lawyers, anything you need outside of med. Someone in our cohort has got that covered because they've done that prior to med, right? And so I think that's really unique. But I do think that for that reason, my uh my sort of posting definitely targeted them or targeted those sorts of people because it was that atypical med journey. And I had people in the year above that were skeptical of me coming in. And that was quite difficult coming in, like coming in as a first year student and knowing that the second years potentially already don't like you or already think quite poorly of you was not the best experience. But you've almost got to just prove yourself. Like it's one of those things that you're never going to change what people think about you. And definitely posting online, people have already got this idea of who you are, and what you're like. And so it's just showing them this is actually what I'm like. And either you were accurate or you weren't, but that's on you. And so that was definitely something that I've had to learn and develop as coming through with a social media following, is that oftentimes it's a reflection on them, and not taking that to heart as much. But my cohort, from what I know, majority wise, have been really, really supportive and lovely.
Yeah, no, from people who I know at Notre Dame, I have a couple good mates that go there, and from the students that I've interacted with, like they're all like excellent, like very like well-rounded, like actually like were like real jobs and stuff like prior to coming in. They weren't just like as I said, like a student in like a science theater regurgitating the Krebs cycle.
Yeah, the bloody Krebs cycle.
And like with all the social media stuff, like it would have been nice like to help support yourself. I'm sure that maybe you're getting a little bit of kickback from some sponsorships or some deals and stuff. It's good like that you don't have to like stress about working like part-time in like a cafe or whatever while you're doing med. You can just focus on that, which is kind of nice, right?
Yeah, it's been really nice. It's definitely like, as I said, coming into med, it's I only want to promote things that are sort of ethical and things that I actually would use or believe in. So that definitely cuts down the pile quite a lot. So I do work as a coach on the side, which is 1 to 2 days a week. But yeah, I was working as a nurse, and I decided I've kind of got to protect my peace a little bit. And coming from a job that's super stressful and like understaffed is just not great to then turn around and come into med and be stressed all the time. But I TikTok definitely does give you like financial help for sure, with brands and things, but it is about selecting, who you want to work with so that it doesn't turn around. Like you wouldn't go and advertise like a greens powder, or like, and then turn around and be like, this does X, Y, and Z, or like you wouldn't, you've just got to be really mindful of the things you're saying, because people do definitely view you, even as a student, as someone that has quite high health literacy and therefore should be followed. And that's a little bit scary, I think, as well. Knowing that anything you can say could be taken out of context or could be taken literally, is again, just being so mindful, even with sponsorships and with income.
Yeah, you got to like triple check everything that you say, which isn't a bad thing, to be honest. But
No, I agree.
and how long did you work as a nurse, like while you were studying med, or did you give up on that pretty quickly because you're like, oh, this is just like a lot, and because other people work in like their previous allied health field, like as a physio or as a pharmacist or whatnot, right?
Yeah. I actually worked as an AIN, which is an assistant in nursing, after first year. So from second year, third year of nursing, I was working at like one of the trauma hospitals here in Sydney. And I loved that as I was doing my undergrad. That was amazing. You're definitely sort of bottom of the barrel according to everybody else, which I don't agree with, having done that. But at the time you are. And so doing that was excellent. And then, yeah, I started med straight away, which was, I'm really thankful that I was able to just kind of transition straight over. And I did a bit of casual nursing on the side. So I was working in aged care, and then also a little bit in theatres, funny enough, and doing that casually. And then it was kind of partway through last year, I'd say towards the end of last year, that I was like, this is just like, yeah, it's a lot. It's a lot.
Yeah, fair. I feel like theater is just calling your name, to be honest.
No, I know I can bash it, but I feel like that's where I'm going to end up.
And do you reckon like there's been any like skills that you reckon are transferable or maybe not transferable from like nursing to medicine, or is it just a completely different kettle of fish?
It is completely different, but I think the skills of talking to patients is like something that I think I definitely have strong stead going forward. I've had, really difficult conversations, particularly with palliative patients, with kids, with families, and sort of knowing the difference between patient-centered care, person-centered care, and then family-centered care, I think is something that nursing has really given me. That, I don't feel awkward having conversations with patients. I don't feel awkward with what a patient's going to come forward and tell me. And so I think that really has come a benefit from doing nursing first. And I think even next year and the year after, I think people still may not, or med students still may not get that level of exposure until they are a junior doctor and they're having to have those conversations by themselves. And that's something I was doing as a student, obviously under the direction of a doctor and of my nurse. But I think that's definitely something that has been very transferable. The skills as well. It is hard. Like, as I said, I started my nursing degree in the States where nurses are given a lot more skills that they're actually able to do. And so I was able to do stuff over there and then wasn't able to do any of that here in Australia as a nurse. But then we're picking up now in medicine, which is good. So there definitely is transferable skills. Yeah.
So for the States, like you were there because of your sport, right? And then you did nursing as well. Like that was your study.
Yeah. So I was there, sport and academic. Yeah.
Yeah. And what were like the skills like that you're talking about, like that you'd learn over there that you couldn't do here?
So, like, cannulation is a big one. Something that you do as a nurse over there, and you'd be expected to do like as a skill. That's just, nurses oftentimes just do cannulas over there, and no one bats an eyelid. And then you come over here, and it's like that's an extended skill. And you're like, okay, fantastic. And it's something where, like, even my friends who are working in ED, ICU, like, they have to do this insane package for being able to cannulate, for goodness sake. Like, I understand the need for it and I understand why it's there, but I also don't. Because I think that we are um, not giving nurses like what they're actually capable of doing. And I think, and I spoke about it quite at length in my nursing degree because it really bothered me in my nursing degree, was that it was in all the textbooks, like all these skills, like for example male catheterization, like it's in the textbook, it's there, you're looking after PICC lines and arterial lines and stuff like that, it's there as a student in your textbook, and yet you can't do it unless you've done advanced training, and that comes after your first year of nursing. And like a really good example of this, I think, is that I went last year on a placement with the Rural Doctors Network, and that was going out like into the bush essentially and working in the hospital there. And bearing in mind, my last placement before this was a nursing placement. Like, I'm the same person. Nothing has changed about me. I'm just in a different degree. And the level of respect differences was insane. The things that a doctor would be like, have you seen how to do this? And I'd be like, yep. And he'd be like, no worries, go and do it. If I was in nursing, forget it. You'd have to show that you're able to do it 50 times before they let you on a patient. Like, I just think that there's, like, obviously it's there because there have been issues in the past, and maybe there's just not the standard of people graduating as far as, say med, where everyone's sort of filtered through a standardized exam at the end. But yeah, I think it's selling nurses short at the end of the day when you're not giving them, the tools to actually go forward and do these sorts of skills.
Yeah, I feel like, there's been a lot of reason for that in the past, and there's, lots of reasons why that is like nursing is the way it is. But then again, you look at medicine and you're like, I think about some of the stuff that I've learned, and it's like you either watch it once, watch a YouTube video, look at it in a textbook. Sure, you had a couple lectures on it, but then it's like, watch one. So what is it? It's a see one, do one, teach one. Yeah. So it's very much like that. And sometimes you like need to like just do one and then teach one. Like it's very much learning on the job. And nursing is completely different in that. It's so protocolized. It's so like regimented. But even then, like, working as a doctor, nurses won't do stuff unless you document and, specifically, like it's very like, whereas like doctors be like, oh, just do this. And then you as the JMO or the resident just go and do it. So it's different in that way. But yeah, I think it does provide like limitations and stuff for like the overall service, and maybe it does need to change in the future. But the best way to do that, I'm not too sure.
Yeah, no, I agree.
Yeah, yeah. And like, I'm sure you've interacted with like a lot of doctors as a med student, but also as a nurse. What do you reckon some of the worst things were, or some of the best things were that you experienced?
Um, I
Or do you not want to say?
no, I'm happy to say. I think, like, looking at my experience from both, like good and bad, it has definitely molded who I want to be as a doctor moving forward. I think to those calls that you just dread making, right? As like a nursing student or a nurse, or even I haven't done it yet, but even I'm sure as a med student where you need to call the consultant because they're on call and they're out for dinner and they don't want to talk to you, sort of thing, and you're like, oh my gosh, I do not want to call them, right? And that hesitation is never something I want someone to have for me as a doctor moving forward, because obviously it hinders patient care and a bunch of other stuff, right? But equally, like I think of the bar is sometimes so low, isn't it? Like I think of the doctors that would clean up after themselves after they've come in to do a cannula on a patient, and you'd be like, wow. Or if the patient's like, oh, I'm really thirsty or I need to go to the bathroom, and they help the patient, and you're like, oh my goodness, go you, right? As opposed to being like, oh, I'll get the sister to deal with that. And so I think, yeah, there's definitely been a bunch of good, a bunch of bad experiences along the way. More good, I'm sure, than bad. But yeah, I think I've also had when I was a nursing student and I'd said that I wanted to do med, like in sort of a natural conversation. Um, all like the doctors that I'd actually said it to, which obviously was a neat few, were so supportive. They were so encouraging. They were so beautiful about it, and sort of really probing with like, where do you want to go, like, do you know where you want to be, like, this is where I went, this was my experience. And so I think as a whole, like, we really work really well together as a healthcare team, and that's one of the things I love about New South Wales, at least. So yeah, I think just shaping the way that I want to practice in the future is definitely what being a nurse first has given me, and seeing that end of the stick as well, with the way that people interact with nurses, I think is very telling of their personality.
Yeah, agreed. It's a bit like that old thing where people say, "Oh, the way you interact with like customer service staff, like waiting staff, like that's like indicative of your personality and everything like." Yeah, but yeah, the reason I ask is because I just finished doing I did like a little video ask where I like asked like people to respond, and they like told me their best and worst interactions with doctors, and I like asked like a whole bunch of nurses, and some of the responses are like absolutely insane because like they say, oh, like they did this and that, but then some of them are like, oh yeah, we helped like wash someone and like transfer them and all these things, and you are completely capable of doing these things as a human being, but yeah, some people just don't think that that's what doctors do. Whereas, like, well, you're just a person like everyone else. But yeah, it's interesting the role and the stereotype associated with it.
It is very interesting indeed. Yeah.
Yeah, fair enough. And like, how, what would you say to maybe another nurse or maybe they're a different allied health specialty or something like that, and they're thinking, maybe med. Like maybe I just like, got to scratch this itch and go down this like, pathway. Like it's definitely possible. You've proven it as far as like, other people as well have proven it. But what would you say if they're sort of like on the fence, like, should I do it? Should I not? And what piece of advice would you give them?
Good question. I think I would say find your drive. Like what is the reason that you want to go into med? Is it because you want money? If so, business maybe is your avenue. Because med sure as hell isn't gonna be it. Is it something like you're wanting a little bit more out of whatever you're doing in whatever avenue that happens to be? And I think just looking for what your drive is and then figuring out the best way forward. I don't, yeah, it's hard because I think I do have a friend who has been wondering if she wants to do med, but she doesn't know why. And it's almost like you do at the end of the day really need to have a why. You need to have a why for anything you do, because for those nights that you're being called in, like you're at dinner and you're being called in, you've got to be like, this is what I want to do. This is, this is what I signed up to do. This is why I worked my ass off for all these years, is the why. And so I think once you've found that, if you're still kind of like, yeah, I really think that this is what I want to do, give it a go. Like, absolutely give it a go. I think people that have gone down a different avenue, say in healthcare, that then turn to med or any other degree, like if you're turning to physio or you're turning to nursing or midwifery or whatever, and they give it a go, I think they're the ones that really stand out at the end of the day, and they're the ones that like have shown that desire to be there, as opposed to someone whose parents are doctors and they're kind of that prodigy child and they've come straight out of high school. So I think give it a go. And if you get partway through your degree and you're like, this is not what I wanted to do, there is also no shame in tapping out. There is no shame in tapping out. As I said, you're going to be 30 anyway, so you may as well be 30 finding your niche of what you want to do than being stuck somewhere because you think I've just racked up a whole lot of debt.
Yeah, it's scary. You keep on mentioning 30, and I'm pretty close to that as well. So I'm like, oh,
But you're a doctor, so it's fine. Like you're happy, right?
yeah. Doctor wanting to do surgery. Exactly.
Fantastic. So
Uh,
you're fine.
yeah, no, everything's good. I feel like sometimes, you know that there's a meme of that guy just like sitting in a chair and there's all the fire going on around him, and it's like, I'm fine. It's like a big speech bubble. I feel like that's me sometimes, but yeah, you constantly like question it, right? You constantly question like, is this what I want to do? Is this like the stuff that I want to do at the end of the day? And then you think about like the daily routine of like, what do I enjoy doing? Like, do I enjoy doing a long ward round? No. Do I enjoy sitting in clinic all day? No. Like, do I enjoy like doing stuff, doing procedures? Yeah, like that's like, it's just reaffirming and validates your trajectory. So if you figure out that, then, everything else will like figure out like along the way, it'll figure it out itself. So I think that's excellent advice. But yeah, some people just think like, oh, doctors are like the smartest people. I'm only, this or I'm only that. Like, no, you can definitely do it. It's just study. It just happens to be like in the medical field. That's as simple as it is. Well, look, I reckon let's wrap it up there. Thanks so much for coming on. It's been really cool to like hear from like a nurse who's now like, on the journey to become a doctor. It's super inspirational. I think more people should do it, like transition like different between different healthcare specialties. It is, it's good. Like it's good to get a different perspective of how other people like work, and then I don't know. It's just easy to transition between different things as well. So, yeah, thanks very much.
Awesome. Thank you very much.
That's all good. All right, so that's the end of that conversation. If you want to be part of something like this, you think you have an interesting story in medicine to share, maybe it's how you got in, and maybe it's that you got on a different training program or you went through some adversity, that's something that you think you'd be interested in doing, then send me a message. The link will be in the description how you can get in touch. If you know someone else that's probably keen to share their story, or you think that they would be a great person to share on this, then definitely link them in and we can get them on. If you want to stick around, there's plenty of other videos on here to check out and keep you informed, keep you interested, and keep you learning more about medicine. So there you go. Otherwise, we'll see you next time. Bye.